Ocala's information station, 1370 WOCA. Ocala!
All right, just about 5 minutes after 11 o'clock. Thank you for tuning in this Friday morning. I hope you're doing well. If you or somebody you know has a penis, you might be interested in this next interview.
Good. I'm all ears.
I couldn't wait to do that today. You know what I wondered about one time, Robin? I know this is my crazy mind always thinks.
That's okay.
But I was thinking, like, during creation, when God was creating man, he may have had some help, let's say from the angels or something, and they was, what's this thing going to do? Well, that's the liver. That's going to filter the blood. Well, what's this thing going to do? That's the heart. It's going to pump the blood. Well, what's this? This is the brain. That's going to help the person think and move and everything.
Yeah.
What's this? This is the penis. What's this going to do?
There you go.
Well, this has two functions, really. This is going to help him eliminate the unwanted fluids that the kidneys have extracted from the body.
Yes.
And it's also going to help recreate other human beings and just give immense amounts of pleasure to hopefully two people at the same time.
Exactly.
Really? Now, that's a pretty cool invention. And we giggle about it. We laugh about it. And the truth is, it's a pretty important part of our lives.
Yes, it is.
And why am I talking about this? Because there's a book here, and we've had this author on before. He's a surgeon, and I just said to him, he's out in California, in Los Angeles, and I said, boy, thank you for getting up early to be with us. He said, no, this is late. I'm a surgeon.
Yes.
So that means he probably was involved in surgery during the night. We'll find out. His book is called Penis Power, The Ultimate Guide to Male Sexual Health. And before you think this is going to be silly, it's not. We'll have fun with it. But it is very serious. If you've ever been worried about the prostate issues, most notably the prostate cancer issues, the doctor will be able to answer some of those questions. Practical, safe, no-nonsense advice for both men and women, the facts about erectile dysfunction, potency, and the prostate, and some tips for a healthy, active sex life at any age. It's the ultimate guide to male sexual health. Penis Power. Dr. Dudley Seth Danoff out in Los Angeles, California. Always fun to have him on the air with us because of the title of his book.
Yes.
Which I think was a move of genius to do that. I just don't know how easy it is for him to get radio hosts to talk about it.
Yeah.
I'm guessing it's probably not so hard anymore these days. It was a double entendre, wasn't it?
I know. I thought it was great.
Dr. Dudley Seth Danoff. Good morning, Doctor.
Good morning, Larry, Robin.
And so you're up late. Were you involved? Were you doing surgery last night or this morning?
Oh, early this morning.
Gosh.
What were you helping with? What were you doing?
We had a gentleman with a little prostate problem. We did an operation which is commonly known as a TURP, T-U-R-P, sometimes the Roto-Rooter. We make the channel a little bit larger so that he can urinate more freely.
Oh my!
Oh really? And but you touch the prostate at all, or is the?
Yeah, you do it. Actually, you do it through the penis. You use a fiber optic camera and a scope and lasers, and it's really pretty neat.
Wow! Is it common?
Very common. It's the TURP to the urologist is what the cataract is to the ophthalmologist. A very common operation. As men get older, the prostate gets larger. And it becomes more difficult for them to urinate. So it is a very, very common operation. Of course, we have good medications today that have made the operation much less common than, say, 20 years ago. But
really?
An operation.
And if and this kind of operation, is the patient awake, and is it in office visit, or do they have to spend the night at the hospital?
It's usually done on an outpatient basis. We give the patient regional anesthesia, so they are awake, but the area that we're working in is asleep. But the patients are actually awake.
Oh my!
There's no incision. It's painless, and it's very, very, very effective. And one thing I was so delighted to hear you and Larry giggling about this word penis. I went to Princeton. I trained medically at Yale, so I'm a mainstream urologic surgeon who had a funny idea for a book, and there's been tremendous pushback because of the title, because I used the word penis on the cover of the book. And penis is not a pejorative word. You know, the penis to the urologist is what the stomach is to the gastroenterologist. So let's get over it. It's a body part.
Well, I'm with you. I'm with you. And the truth is, it's really an important part of our relationships. I mean, if you want to look at it from a purely biological sense, we're not. We're humans. We're not animals.
Yeah, we shouldn't be, we should be giggling about it, because if you don't have a sense of humor about your member, I feel sorry for you.
That's right.
Sounds like a part of a club.
The male Dolly Parton.
Yeah, right. I mean, I've had interviews that have, off air they say, well, just don't use the word too much. I mean, we love your book, and we love you, and you're funny, and you're insightful, but don't use the word too much, okay?
Well, this is what I say. I don't say it's a member. I say it's the entire club.
Yeah, that's it.
That's right.
You like that?
Men are penocentric. I mean, we all know that.
Yeah, I mean, I guess the world is. Can I ask you something that we hear advertisements now and then? What are your thoughts on? I don't know what it is, but every once in a while you hear like an herb or some kind of a supplement that they say will improve prostate health. Is there any truth to that?
Well, there are some herbal substances. The main one being saw palmetto. Which acts like finasteride and actually shrinks the size of the prostate. So there are some herbs out there. The problem with the herbal preparations are they're not FDA approved, and they haven't withstood the scrutiny, of a well-balanced crossover double-blind study, because those studies are very, very expensive. It's very difficult for an herbal manufacturer to get a patent.
Okay.
So some of them are good, and some of them, I think are placebo.
So here's another question. And this is a real sensitive one. I hope nobody's offended by this one, but maybe I'm not the only person who's wondered this. If a guy is not very sexual and he's not orgasming very often, does that actually do him harm?
It probably doesn't, and the converse is also true. It's very difficult to wear out your penis with too much sex.
Oh, wow. Good to hear.
Use it often. And there really is no predetermined number of orgasms, no quota of erections or ejaculations, and no upper limit that can't be exceeded. And I think the same is true on the other end.
Now here's a very naive question. Now, when Charity Bono turned into Chaz Bono, and he had that operation to have everything male, does he have a prostate? Does he have some of these things that could affect him like they would if you were born with it?
Oh, wow. Yeah.
Number one, he does not have a prostate. Number two, he does not have testicles. He may have something that looks a little bit like a penis. So they would take the clitoris, they would use some skin grafting, and then put a prosthetic rod or prosthetic prosthesis in to make it look like a penis. So he's getting exogenous testosterone with injections, but he doesn't have a prostate, and he doesn't have testicles.
Does he have the same experience that a man has in sex?
He would probably have more of a reaction of a woman having an orgasm with clitoral stimulation.
Okay, so there really is no person on earth who can tell you what the other sex feels like, because we only know what we feel like.
Exactly. I mean, we know that a lot of people fake it, more women than men.
So
it's
chances
hard for a man to fake it. A woman could say, you're the best, you're the biggest, it's the greatest one I ever had. I think we have all heard that.
So my guess is that what's his name now? Chaz. Chaz probably still likes chocolate a lot because women always say chocolate is better than sex, and I go, wow, you must not have the same experience that we have. I can't even compare.
We're gonna have to ask him really to find out. Look, the sex is not an athletic event. It's not about the Sochi Olympics, how fast you can go down a hill or how high you can jump. It's about passion and caring and tenderness and mutual admiration. I mean, that's what it's about. It's this is not a contest. I don't think, or it shouldn't be.
Now, I do have a follow-up question. If the fellas go the other way and become a woman, do they still have a prostate, or is that removed?
Usually they would still have a prostate. A prostate is a big operation, and most transsexuals who become women do not have their prostate removed.
So they could still have male prostate problems then?
They absolutely can. Absolutely can.
All right, we do have a phone call, and I would like to invite everybody to call. If you have a question for Dr. Danoff, and please excuse our silly approach to this because that's kind of the way we are. But if you've got a serious question, please don't hesitate to ask it. The number is 622-9622. The book that might answer the question for you in more detail is called Penis Power, The Ultimate Guide to Male Sexual Health. Dr. Dudley Seth Danoff getting up early to be with us out in Los Angeles, or staying up late maybe is more appropriate. Good morning. Thank you for calling. You're on the air.
Yes, good morning, doctor.
Good morning.
Do you have to have a prostate to have sex?
Absolutely not. And the best example of that is the early diagnosis of prostate cancer, in which we remove the cancerous prostate with the use of a Da Vinci robot, and we preserve your ability to have an erection. We preserve your ability to control your urine. So you will get an erection, you will have an orgasm. The only thing that will be different is less fluid will come out. Some fluid will come out, but the prostatic fluid, which is the primary fluid of semen, will not come out. But by all means, you can have a full, enriched sexual life without a prostate.
Thank you.
All right. Does a vasectomy diminish the amount of fluid?
Absolutely not. I mean, the number of sperm in an ejaculate, you could fit on the head of a pin, 1 million sperm. So the primary fluid is from the prostate, and the vasectomy has nothing to do with that. It doesn't make your hair fall out or your members shorter or in any way affect you, except you can't have a baby.
I'm going to ask a question that has a presumption in it, and I might be wrong. So I forgive me for that in advance. I've always heard that the older a woman gets, the more likely it is that the eggs that she's producing will produce a child that might have issues, might be born with problems. That might be the presumptuous part. Maybe that's not even true. Does that happen to a man's sperm too? Does an older man who decides that he wants to father a child risk having maybe a handicapped child? And again, I'm not trying to offend anybody. I'm just wondering.
Well, the evidence is not really all out on that. In general, what happens as a man gets older, he produces fewer sperm, he has fewer ejaculates, but it only takes one good swimmer. So if you envision a sperm as a bit of a tadpole, it has to have one head, one tail, and be a good swimmer upstream. So it only takes one. I think this congenital anomalies in older women, it's more prevalent in women than men. So older men, as we well know, it's not uncommon for an older man to have a child with a much younger woman. So the majority of those relationships are okay, and I think it's more on the woman's side with the abnormality with the ovary and the egg.
You also touch on the man's emotional health in your book.
Oh, absolutely. I mean, it's a direct line between what is going on between a man's ears and what is going on between his legs. It's 99% between his ears and 1% between his legs. Having an erection and having successful sex and caring is very, very psychological, very mind-oriented.
So when a woman and a man enter into a relationship, it really should not be about all of the physical attributes, that the couple should really concentrate on the emotional aspect and their compatibility.
Oh, absolutely. Man is a child, and he's even more of a child if he has an erection. So if a man has anxiety, I mean, that is a penis killer or an erection killer. Fear, anxiety, self-doubt, all self-fulfilling prophecies. You doubt that your organ is going to work, and it becomes an ever-decreasing circle of doubt until, as the dog running in an ever-decreasing circle, chasing his tail, ends up in his you-know-what.
Wow.
Dr. Dudley Seth Danoff is our guest. His book is called Penis Power. We are accepting phone calls if you have a question for the doctor. It could be about the prostate or anything sexual, really, in nature, especially from the man's point of view. But you do have advice in the book for women as well.
Oh, yes. I actually have a whole section devoted specifically to women. I want every woman to be what I call a penis professor, to know everything about, the penis in her life, how it works, where it works, why it works, what turns it on. And you can go to my website, which is penispowerbook.com. I mean, there's a lot of good stuff there. It's funny, it's insightful, it's medically accurate. Your listeners will just chuckle and laugh and learn something.
Okay, I have another question, and boy, again, I'm stepping on this line here that I'm trying. It's medical in nature, but it's this part of the body that gets us a little giggly. All right, I know a guy who told me a story, and I wanted to tell you the story, and because I thought, really, because I've never had this medical procedure done to me. This is what he told me. He said the nurse, I'm imagining it's a female nurse, went in through the back and drained his, what do you call it again? Prostate.
Yes.
And when she pushed on it, it drained it. And when it drained, it had the exact same feeling as when it drained the normal way. Is that true?
Well, you don't really drain the prostate. It sounds like what this nurse was doing was giving him a prostatic massage. So what happens sometimes, we get prostatitis, and fluid accumulates in the prostate,
Yeah.
and then the doctor or the nurse practitioner will sort of squeeze that fluid out, so it does feel a bit like the fluid. It's not like an ejaculation, although that could
That's
happen.
What he said. But that's what he said. He said it felt just like it.
Then he was stimulated sexually. But when I've done that, and I've done it thousands of times in patients, it's hardly a sexual act.
Oh, really?
But yeah.
So nobody.
It's less common to do that now in the old, as they say, in the olden times when we didn't have much in the way of antibiotics and other technical things that we do. It was more common, but some physicians still do it.
All right, so they're not throwing their head back in your office and saying, "Oh God."
I'm sure it would be one out at the end of the day if they did that. It's sort of funny. I mean, to have a digital rectal examination, which is an important part of the male annual physical, is a very unpleasant examination. And I love when the patients say to me, "Doctor," they said, "I hate this." I said, you have this once a year. I'm doing this 30 times a day. How about feeling sorry for your urologist?
No.
Oh, gosh. Can you imagine?
Oh, no. Have you ever seen the duo? It's a female duo. They sing, they play guitar, and they're cute young women, and they call themselves Garfunkel and Oates. Have you ever seen them?
I have not.
Oh, you got to look them up.
Yes.
Yeah, they do a song about manual stimulation of their man. And it's got a title that I won't say on the air, but you get the idea. And this, I guess it's not a serious song. It's a very silly song. But the serious message I took from that is that sexual favor, if you will, that they're talking about in the song is something they don't know how to do, which is what the song is about. And they're saying, nobody ever taught us how to do this. They taught us how to have sex, but they never taught us how to do this. And all the guys want this.
Well,
who would have thought that that's even a mystery?
I'm no authority on that. I admit to being a recipient, but no authority.
You got to look up the video. It's a very funny video. A very funny song. Yeah, they're cute.
With all the warnings and stuff that's out there now, and sex is sort of like an open book, have the cases of syphilis and gonorrhea and that type of thing gone down now?
Well, certainly syphilis has gone down. There is a lot of chlamydia. There certainly is a lot of gonorrhea. Unprotected sex is still quite common, I'm sad to say. I think a lot of people have had a wake-up call with the HIV/AIDS, at the forefront. So there is more protected sex than unprotected sex, but there are still a lot of silly people out there having unprotected sex with partners that they really don't know their sexual history about. So we treat gonorrhea regularly, chlamydia, a lot of sexually transmitted diseases. Syphilis is less common, although I do see a few cases a year. And my office is in in Beverly Hills, West Hollywood, so we have a very large gay community, and I'm sad to say I love the gay community, but they tend to be a bit more promiscuous than the straight community.
Oh, my.
Yeah, that's what I've always thought too. All right, the book is called Penis Power. We've still got a few more minutes. I want to make sure we get every question out there that possibly could ask. You do approach the book with a sense of humor. Even the illustrations are very humorous, actually. Were you with the artist when this was done, or did he or she hand them in, and did you?
Well, actually, we had this idea about penis personalities, where a man is the same in the bedroom as he is in the boardroom. If he's silly in the bedroom, he's silly in the boardroom. If he's pompous in the bedroom, he's pompous in the boardroom. Persnickety. So we took a lot of these words, promiscuous, and we gave personalities to them, like a horoscope. And then we drew these little cartoon figures to represent, a pompous penis personality, a persnickety penis personality, and a persuasive penis personality. And we took all the P words and we had some fun with it.
That's fun.
I'm not an artist, but I did sort of create those with an artist, and they are kind of funny if you don't take them too seriously.
Very funny, yeah.
Should a man go to a urologist once a year for an exam? Because sometimes it's more than that. The man just needs to have somebody as a sounding board for whatever is going on in his life. So he comes in for the exam, and also for the urologist to be a psychologist as well.
Well, I think that's an excellent question, Robin. I mean, a woman would never miss her yearly mammogram or her pap smear. Men want to be a hero. They want to catch the pass in the last minute of the fourth quarter of the Super Bowl. They're macho. They have to be pushed, shoved, begged, cajoled to go to their urologist. Yes, a man after 40 should come to see his urologist and get a proper physical examination and share, his doubts. Or, Charlie, are you having ED? Can we help you? We have a menu of things that we can do, from simple pills to something a little bit more complicated. So I certainly encourage the men to seek their urologist or a practitioner who is receptive to their needs. Absolutely.
So let's talk to that guy. Let's say he's listening right now, and he was taking Viagra or something like that, but then the doctor said, you got a heart condition, we better stop the Viagra. Is there hope for him? Can he visit a doctor like yourself and perhaps get back into the saddle?
There are many things that we can use beside Viagra, Cialis, Levitra. And by the way, you can use those drugs with a heart condition. You just can't use those drugs if you take nitroglycerin. But you can have...
You'll explode, right?
Wow.
Well, it's because they're vasodilators, and you can get a double drop in blood pressure. But there are other things. We have the Muse system, MUSE, which uses a drug called prostaglandin E1, which is absorbed locally and creates increased blood flow. We can give you an injection. And there are always these prosthetic devices, which are analogous to an implant in a woman's breast. They're very successful. Not as good as the real thing, but older men are still motivated. We encourage them to do it, and they are definitely amongst my happiest patients.
So is there, I've heard at least 2 stories in my lifetime. I'm almost 59. I'll be 59 tomorrow, actually. But I've heard at least, I've heard 2 stories in my lifetime of guys who died while doing it. Is there a reason for that? I mean, why would somebody die at that moment?
Well, first of all, Larry, we all die, and I can't think of a better way of dying. Look, sex is a vigorous sex is a very vigorous activity. It's a stress on your cardiovascular system, and to produce and maintain sexual health, you have to have good physical health. So you have to be in good physical condition. You have to have low weight. You have to watch your blood pressure. You have to have your diabetes under control. You have to take your hypertensive medicine. You got to go to the gym. So it's a very strenuous activity, and men do die during sex, if they're ill prepared.
So I have a really dumb one. This is a dumb one. I apologize in advance. If a guy, let me explain where this is coming from. I just revealed to you my age. I also need to reveal to you, we broadcast now from a mall, which means lots of pretty women walk past, and they're really all inappropriately young for me.
They're hot.
They're very pretty, very inappropriately young, okay? Is there a way to turn off that attraction?
Well,
Do you know when they have
first of all, if there were, I would advise you not to.
There you go.
Well, you know, like when they have a guy who's been arrested for sexual crimes, okay, and they say they're going to medically or somehow surgically castrate him, right?
Yeah.
Does he no longer have interest? Is that what happens?
No, that's a fallacy, because testosterone, which is what drives libido, is also produced by the adrenal glands. So all these guys in the old days in the harem, they couldn't impregnate the women in the harem, but they certainly could get an erection and have a heck of a lot of fun.
Oh, really?
Castration does not make you impotent, and castration does not make your libido go to zero. It'll reduce your libido, but definitely not put it to zero.
Oh, wow. Wow.
And now, how about all of the students out there that are young athletes? They're in high school, they're doing football, track, and all of that stuff, and then they turn that into a professional career. Is there more chance of them having problems with their prostate if they do non-athletic activities?
No, I mean, you're talking about the super jocks. No,
Yes.
super jocks are great, and they should be, very athletic and very vigorous in their performance of sex. However, the one caution is a lot of these fellas are being juiced. They take the anabolic steroids, which are the testosterone components and derivatives, and those are problematic. They will shrink your testicles, give you acne, create heart disease, increase the thickness of your blood, and make it prone to emboli and heart attacks. So it's great to be a muscled athlete, but if you juice, as some athletes try to do to get an edge, that's really bad.
Well, one of these days we'll have to visit you out in L.A.
Yes.
or if you're here in Central Florida, come and visit us. All right, I have a copy. I have a copy of Penis Power. Let me give it away to somebody. Call me.
It's a great book.
You can use a fake name. Tell me you want the book, and I'll leave it at the desk here for you at the radio station. The rest of us have to go buy it. Dr. Dudley Seth Danoff is the author. The book, again, Penis Power, easy title to remember. Do you have a website for the book?
Absolutely, penispowerbook.com. It's fun, it's informative. I'm sure your listeners will love it.
All right, where does the internet take you if you don't put the word book? Just
He's
teasing.
never checked it.
I'll try it. Don't worry. It'll give me a reason to look at something inappropriate at work. Good morning. You've got the book. Who's this?
Hello,
Hello. Good morning. You got the book. Who is this?
it's Mark.
Mark?
Okie doke.
Okay.
We'll do that.
And you know we're at the mall now, right?
No.
Okay. Well, we're at the Paddock Mall.
Okay.
Okay. And you're calling in for the book, right?
Yes.
Okay, Mark. You've got the book. It'll be waiting here for you.
All right. Thank you.
All right. Thank you. I think that's his real name.
I don't know. Brave soul, if it is.
We gave away one of these.
okay.
We gave a book once before, Doctor. It was kind of funny. I'll share it with you because you were the author. You are the author, and the person came in, and the woman who was working the front desk at the time was a younger woman, and so he comes in and he says, "I have a book waiting for me," and she goes, "Oh, what was the title?" Because we give away a lot of books. It was somebody they spoke to this morning. He wouldn't tell her. He wouldn't tell her what your book was called. Funny stuff.
I thought you were going to say your young girl at the desk didn't want to give the book away.
Oh no! She went back and got it. She found his name and said, "Oh, here it is."
Well, that's why we just got to get this word out of the closet and on everybody's lips.
Yeah. The one most commonly heard reaction when people walk in to see the statue of David. This was a trivia question we had. It's oh my.
Yeah.
Doctor, you're fine. Thank you for staying up after the surgery, and hope you get some sleep today.
Well, Larry, Robin, it's always a pleasure to speak to both of you and say hello to all my friends in Florida.
All right. Thank you so much, Doctor.
Okay, thank you.
All right, we will take a little break, and we'll be right back.
Do black patent leather shoes really reflect up?
Find out at the Ocala Civic Theater's delightful musical comedy running from February 6th to March 2nd.
Watch from late bloomer Eddie Ryan's first day of Catholic school to the senior prom.
This musical romp goes through confession, poodle skirts, guardian angels, gym class, rock and roll, and the birds and the bees.
Do black patent leather shoes really reflect up? Is set for performances from February 6th till March 2nd at the Ocala Civic Theater. It's a divine comedy directed by Greg Thompson.
Who?
Yeah, that guy. He's an actor or something.
I don't know.
Last year, over $1 billion, that's a B with 9 zeros, was left on the table from taxes not done right. But thankfully, H&R Block tax preparers have over 100 hours of training to help you get your piece of the billion back. Come visit us and our friends at H&R Block this tax season at the Paddock Mall, Marion Oaks, and Triple Crown shopping centers to make sure you get your maximum refund. Don't forget to check with your favorite nonprofit for referral information where applicable.
It's so funny. I'm still laughing at that. 26 minutes before 12 o'clock, Joe Martone is on the phone, and oh yeah, that rhymed. And he's over at the grand opening of AA. Let me make sure I said the name right again. AA Lock, Dock, and Security. They're having a grand opening, and I think maybe some of the biggest fanfare of the morning is already behind us. Let's find out from Joe. Good morning, Joe.
Hey, puppy power!
No, it wasn't Puppy. It wasn't Puppy.
That's what I say.
Oh, really? You call it a puppy?
I'll leave it alone. I reiterate what I say. Leave it alone.
Oh, man. You got a few people.
AA Lock, Dock, and Security over here at 219 Northwest 10th Street right here in Ocala. We'd like to say hi to everyone over there. Come on by over here. The hamburgers are delicious. I had one there. Hot dogs are there. We've got cold drinks to drink. Stop by. Seth is listening in over here. We're going to have some. We're going to add when we come back with Fun with Joe. Seth has just given me a Stanley Fat, they call it, Fat Max Blade Armor 25-foot, tape measure. And on top of that, we're going to add a $20 gift card to Mojo's. That's going to be with Fun with Joe. That's coming up in about 10 minutes. But getting back to where we are, we are at the grand opening of AA Lock, Dock, and Security right here in Ocala. Stop by, say hi, learn, educate yourself on the locks and security and the things that you don't know that you thought you knew about, like I have learned all day today so far. We will be broadcasting here from till 4 o'clock. He'll be here till 5 o'clock, so stop by, say, don't worry about the weather. It's a little misty. So what? You're not outside. You're inside. Come inside. Look, see things. The reps are here. They can explain the thing. How they supply. I talked between breaks. I was talking to some of the reps. How they can supply with over 4,000 items, and that's just one rep. So think if you don't think it would work, he'll make it work. He'll make it fit.